have the next talk. So again, it is the same teleophthalmology in the primary care, but you'll see two different models, how a teleophthalmology in the primary care is done at Arvind and at Shankar Nethralaya. Dr. Sheila John, please. Dr. Sheila John heads the teleophthalmology unit at Shankar Nethralaya.
Yes.
Can you make it full screen? Yeah, done.
Good evening. My topic today is teleophthalmology in primary care using mobile vans. Healthcare availability in India, population of more than 138 crores resides in India. 80% of the population reside in rural areas. 70% of healthcare resources are in urban areas. One ophthalmologist per 1 lakh population. Shankar Nethralaya Teleophthalmology Mobile Unit was started in 2003 with the help of Indian Space Organization. They provided the satellite connectivity which was mounted on top of the bus. This bus had an examination room inbuilt in the bus where patients could be seen, plus video conferencing unit was also there. So teleconsultations could also be done. But the disadvantage with this was one optometrist was seeing the patients. So only about 30 patients could be seen in a day. So by 2010, we shifted to internet connectivity. We did comprehensive eye examination in rural areas at the patient's doorstep with spectacle dispensing, eye screening for school children, and diabetic retinopathy screening camps. The number of camps were from April 2000 to March 2020 was 1,889 and total patients more than 1,50,000. Here in the bus, we do not have an examination room. This bus carried the paramedical staff and the equipment, and a facility was found in the villages where we could download the equipment and use it. I would like to share a video with you where we are conducting the camp in a rural area. For conducting the camp, the permission of the district blindness control is needed, as well as you have to inform the Gram Panchayat person who he will look for a facility or a house which will be provided to conduct the camp. This is a rural village where in the morning, with the help of the Gram Panchayat person, we have collected about 100 patients for examination. They're waiting for the bus to come in. The bus with the paramedical staff and the equipment reaches the campsite. Again, there is no examination room in the bus here. The paramedical staff download all the equipment and set up the facility in the facility given by the Gram Panchayat person. Announcements are made before starting the camp, and demographic details are entered in the electronic medical records. Refraction is done with the help of auto refractor. Then subjective refraction is done, both for distance and near. And if patient has any spectacles, the power is also found out using the Lensometer. Again, all the entries are done in the electronic medical records, which is an offline electronic medical record. One acts as a server, the other one entries are made. And once all the entries are done, it is got to the base hospital and uploaded in the server here. It's a completely offline server using a Wi-Fi connection there. Slit lamp examination is done, anterior segment as well as intraocular pressures are checked with applanation tonometry. Anterior segment images are also uploaded into the electronic medical records. All the findings are recorded. Fundus examination is done. Non-mydriatic, we do not do any dilatation drops. Dark adaptation is done. Again, the fundus images are uploaded into the electronic medical records. Interpupillary distance is taken and glass dispensing is done. Counseling for patients are done. Teleconsultation is done with the optometrist and the patient at the campsite using a laptop and data card. And at the base hospital, the ophthalmologist with the technical assistant is seated. Patient's attender is also counseled regarding whether the patient needs medical or surgical treatment. If surgical treatment, how many days you have to stay in the hospital is also discussed with the attendant. The patients which require cataract surgery are picked up and taken back to the camp. In the particular camp, about 100 patients were seen. Majority had refractive errors where the glasses were done, taken up for the prescriptions, and then cataract was identified. Next, diabetic retinopathy, then all other features. Here again, I would like to mention that Shankar Nethala Base Hospital, the ophthalmologist is seated, and at the campsite, the optometrist with the patient is seated, and the real-time sharing of images happen. We have a mobile refraction unit given by Essilor India, where we hatch an edger there, so it delivers spectacles at the doorsteps of the needy people. We again, Shankar Nethralaya, in combination with IIT Chennai, had done a mobile eye surgical unit. One of the vehicles is a preparatory vehicle, another one is the houses the operation theatre. From December.
Please conclude, your time is up.
Okay, about 10,000 cataracts have been done. Okay, thank you very much. And I would thank the AIOS team and Josie for giving me.
Sheila, thanks Dr. Sheila for sharing that model.